AB 2533 addresses a simple problem under current law. When an employer helps cover the cost of a gym membership or fitness benefit, that support can be treated as taxable income to an employee. This bill corrects that by allowing a deduction for a qualified employer-provided fitness benefit. This measure is about removing a tax penalty on prevention and wellness. If we want healthier communities and healthier workers, we should not be taxing a modest benefit that helps people stay active. AB 2533 is also narrowly tailored. It applies only to a uniform fitness benefit provided to all full-time employees. It does not apply to country clubs, golf clubs, travel, meals, lodging, or enhanced benefits for highly compensated employees. This bill is designed to support ordinary working Californians whose employers want to invest in their health, but may not have the resources to build or maintain an on-site gym. Current law already favors employers who can provide an on-site fitness facilities tax-free. AB 2533 helps level that playing field for everyone else. I also want to address a few of the committee's concerns directly. First, this is not a duplicative tax benefit. Employers may already deduct compensation generally, but employees can still be taxed on receiving this benefit. AB 2533 addresses the employee side tax treatment. Second, while no policy can guarantee that every single employee will use a gym membership, this bill is about improving access and lowering barriers to healthy behavior. The state should not be taxing a benefit that makes wellness more affordable. And finally, I understand the committee's concerns regarding implementation details, including a sunset and conformity issues. I am committed to continuing to work with the committee on those items as the bill moves forward. Members, AB 2533 is a targeted step that supports prevention, workforce, wellness, and affordability. I respectfully ask for your aye vote. And with me today is Andrew Mock, who's here to testify in support.
No, also do Bob's.
And we're missing one, and he will also do Bob Rodgers. Thank you.
Thank you very much. You have 2 minutes.
Thank you, Mr. Chairman and members of the committee. My name is Dr. Andrew Mock. I'm a primary care physician, quadruple board certified in family preventive lifestyle and obesity medicine. I am the medical director for Hoag Memorial Hospital in Southern California, where I prescribe exercise every single day in my practice for chronic disease prevention, treatment, and reversal. I also serve as a national education lead on the physical activity prescription, working with the American College of Lifestyle Medicine on the lifestyle medicine residency curriculum that will go to 400 residency and fellowship programs nationwide this year, training our future generation of physicians on physical activity assessment, prescription, and referral. As part of that work, I also work with national advocacy groups, serving on the board of the Physical Activity Alliance, the Medical Fitness Association, and working within the American Medical Association as a delegate to the American College of Lifestyle Medicine. And just to prove that we are the tip of the spear that is working to make physical activity assessment, prescription, and referral a standard in healthcare as part of the It's Time to Move initiative, I also practice what I prescribe. I'm 5-time California's Strongest Man, just defended my title 2 weeks ago, so you know that this is something near and dear to my heart. But we have a broken healthcare system. We pay for medications, we pay for surgeries. When it comes to physical activity and lifestyle medicine, we often leave patients with the bill. And this is despite very strong evidence that this is one of the most effective interventions that we have, both from an efficacy standpoint as well as a positive return on investment. Physical activity is a first-line treatment for all major chronic health conditions: high blood pressure, diabetes, obesity, mental health. It reduces cancer risk. It improves cancer survivorship. It is time we give it the respect that it deserves because the evidence is clear. Cardiorespiratory fitness, strength, and power are the strongest predictors of long-term health that we have, up there with blood pressure and healthful body weight. and control of blood sugars. But the real barrier comes with access, equitable access. Those with the least have the least access to this powerful intervention. If you can afford to pay for your own exercise, you get much better health care in our state. I want to give you one quick example. 2 years ago.
Can you finish your thought? Your 2 minutes are up.
Yes.
Just finish your thought.
Very powerful story. One of my patients came in, difficulty climbing up 10 flights of stairs. We started her in a community-based exercise program that cost $50 per month. 4 months after that, she was able to go to 1,000 Steps Beach with her church group and climb those stairs without assistance.
Thank you. Thank you very much. Anyone in the room wishing to speak in support of AB 2333, please come to the microphone. Your name, your organization, and this is support.
David Bulldog, SFB Alliance. I apologize for keep on coming back, but I'm a sucker for great tax credits and deductions and support. Thank you.
Thank you very much.
Stephen Stanzer with Brown Scene on behalf of the Health and Fitness Association and the California Fitness Alliance in support. Thank you.
Thank you very much. Any primary opposition to this measure 2533? Would you please come up to the table and have a seat? And you have 2 minutes.
Thank you very much. Again, Danny Kaiser on behalf of the California Tax Reform Association in respectful opposition. This legislation will complicate the state code since there are no provisions existing in federal law. Many employers already provide wellness and fitness benefits which are deductible as a business expense. For those instances that qualify as medical expenses, they are non-taxable, while other benefits such as gym memberships are taxable to the employee. We request a no vote. Thank you.
Thank you very much. Anyone in the room wishing to register their opposition to this measure, please come to the microphone. Hearing and seeing none, I'm going to bring it back to the dais. Any questions from my colleagues? I have one question for Mr. Tangapad. Do you intend to limit the deductions amounts to $600 to make it match the unemployment insurance tax exclusion and add a 5-year sunset to this measure?
Is that what's currently suggested as committee amendments?
It is.
I would love to work with the committee on that, and more than happy to get together and work with that. So, yes.
Okay, great. Thank you.